I'm Ken Peters.
And I'm Dan Sellner.
We're with IPSO, the International Partnership for the Study of Occlusion. We've been teaching occlusion and TMD since the year 2000, and we've been fortunate enough to be coming over to the UK on behalf of BSOS, teaching our 3-day course. The 3-day course is our introductory occlusion course, which is a pretty in-depth, hands-on course. We've been very fortunate to have BSOS, the leading occlusion organization in the UK, bring us over to teach this course, and they've done so for the last 25 years. First with Niles Gachet Associates, and for the last 18 with IPSO.
So you might be asking yourselves, why is it important to have a knowledge of occlusion? When you look at things through the new set of eyes that we will provide in the course, you'll see things that you've never seen before. It will help you to improve your restorative dentistry and make it longer lasting, which is obviously a desirable outcome for all of us. It will also help you with your diagnostic ability and to help with identifying patients who are having problems with clenching, grinding, headaches, neck aches, all the different kinds of things that we see each and every day. The bottom line is we feel strongly that a good knowledge of occlusion helps to make our outcomes more predictable and to make our everyday dentistry better.
So our style of teaching is very immersive. We like to have our delegates get involved in the learning process, so our cornerstone is hands-on teaching, which really gets you deep into the material. It helps you remember what you've learned, and it gives you greater take-home value, so you can take home what you've learned and start to implement it Monday morning when you go back to your practice.
So let's get specific a little bit about what you'll learn from the course. One of the goals that we have will be to show you the difference between a pathologic occlusion and a physiologic occlusion. We all see patients in our practice who have absolutely the worst occlusion in the world, and you look in there and they have absolutely no issues, no problems, no pain, no nothing. Then the next patient that walks in, everything looks perfect. They have a beautiful smile, they have what looks to be a perfect occlusion, and they are in pain. And why is that? These are things that we start to address and start to identify as the building blocks for the course. We talk about the manifestations of occlusal disease. What does it look like? How do we spot it? What are we going to do about it? We talk about centric relation. With centric relation, we talk about what is it? Why is it important? When do we use it? All these different kinds of things related to CR. We'll talk about appliances. When are appliances appropriate? What kind of appliances will work? Are appliances just a magical piece that it doesn't matter what they're designed like? Obviously the answer is no. And we try to demonstrate what about the appliances makes them work, and what, if it's not there, is going to create issues. When in the 3-day course, our goal is to kind of get your feet wet and give you the principles. When you truly learn about these things is once you get to the hands-on course and you are treating your own patients. We will also talk some about occlusal instrumentation. There's a lot of gear out there. What gear do I need to have? What should I buy? The bottom line at the end of the day is we are trying to give you the most practical, effective, and economic method available to acquire this knowledge of occlusal skills, and we feel strongly that you need this to practice in your practice every day and utilize it as part of everyday dentistry.
So what are you going to be able to take home and implement into your practice on Monday morning? You're going to be able to recognize occlusal disease and better understand how to manage it. You're going to be able to recognize an occlusion that's ideal and how to distinguish it from an occlusion that's not ideal. You'll be able to recognize the relationship between the joint and the occlusion and the basics of managing joint dysfunction. You're also going to be able to identify a stable joint relationship and how to use it in our restorative, how to record it, how to implement it into your practice. You're also going to be able to see the relationship between the joints and the muscles and the teeth and how one affects the other.
So what is the one thing that we feel sets IPSO and BSOS apart from the other opportunities that you have available to learn about occlusion in the UK? The main thing is the way we teach our courses. Once you get beyond the 3-day introductory level course that we will be teaching, you will follow through with the curriculum, and the courses will be taught by BSOS members. You will be finding patients in your own practice, and you will be bringing those patients on the course. You will be helped with how to do the exam, how to diagnose their problems, and how to come up with how you're going to treat it. The scenario at most of the courses where you can go to learn about occlusion is you'll listen to lectures, you will hear principles, you may see someone else treat a patient, but typically you are not in a situation where you get to lay your own hands on your own patients and experience the successes and frankly some of the pitfalls. So because you can do that in a supervised situation, we feel it is just light years ahead of going in and watching someone else do it. Until you've gone in and seen the good results with your own hands on your own patients, and be able to learn and see what's going on, we don't feel like you will be able to make it part of the fiber and the core of your everyday practice.
So, join us for Occlusion and Everyday Dentistry and beyond. The course is centrally located at the very nice Park Regis Hotel in Birmingham. Even though Dan and I come from Colorado, this course will happen, including the hands-on components, no matter what occurs with international travel. Unless there's a flare-up in the UK that prevents delegates from getting together for continuing education, this course will go on. Dan and I hope to see you the first week in October for this exciting and interactive hands-on course.